do Olivia Newton-John, Robin Roberts, Sheryl Crow, and my mother have in common? They are all breast cancer survivors. Hi everyone, my name is Isabella Scroy and I'm a student here at St. John's campus. Today I want to talk to you about what breast cancer is and how all of you, including both men and women, can be at risk. I'm sure many of you know someone who is battling cancer or is lucky enough to call themselves a breast cancer survivor. However, if not, I still think it's important to educate and inform you about what breast cancer is, for it could just save someone's life. Many wonder, what is breast cancer and what happens if diagnosed? So let's get started. First, I'm going to inform you of exactly what breast cancer is, the basis of my speech. Breast cancer is a type of cancer that starts in the breast, where the cells in the breast rapidly grow out of control. Breast cancer cells usually form a tumor that can often be seen on an X-ray or felt as a lump. Breast cancer can begin in 3 different parts of the breast. However, the most common forms of breast cancers begin in the ducts, the tubes that carry milk to the nipple or the lobules, the glands that produce milk. Now, there are not many symptoms of breast cancer, and unfortunately, breast cancer can be undetected for years, until sometimes it is too late to successfully treat it. However, some warning signs of breast cancer that one can show are a new lump in the breast, pain in any area of the breast, or even redness or flaky skin on the breast. When one detects such symptoms, they should seek medical attention immediately. How can one be so sure if they have breast cancer or not, if there aren't any symptoms? In reality, there are some steps everyone could, and in my personal opinion, should take to reduce the risk of developing or catching breast cancer at an early stage that is treatable. It is recommended that women at around the age of 40 should begin receiving yearly mammograms or x-rays of the breast. Many women begin to worry. What if something appears in the results of the mammogram? Is it cancer? An abnormal mammogram does not always mean that there is cancer. However, one must go through additional mammograms and exams before the doctor can rule it out. One's doctor will recommend the patient receive a biopsy, the only way to determine if the abnormality is cancerous. The biopsy is a needle that will be used to remove small pieces from the suspicious area, so the pieces could be tested to see if they contain cancer cells. The abnormality could be one of 2 things, a benign or malignant tumor. A benign tumor is one that is not cancerous nor life-threatening. These cells do not travel outside of the breast and do not invade other organs in the body. It can be removed and usually does not grow back. However, a malignant tumor is cancerous and much more serious, for it is life-threatening. It is a tumor that most times can be removed, but there is a high chance that it can grow back. These cancerous cells can metastasize and spread, invading and damaging nearby tissue and organs. A malignant tumor is formally known as cancer. For many hearing the words, "you have cancer," it is the most devastating and unbearable words to comprehend. I do not wish it upon anyone. After receiving the news, the doctor will explain whether your breast cancer is invasive or non-invasive, and he or she will write out a plan on how to attack your type of cancer, basically the treatment you will receive. Now, to explain the difference between invasive and non-invasive breast cancer. Most breast cancer patients have what is called invasive cancer. Invasive cancer cells can grow into normal healthy tissues. Non-invasive cancer stays within the milk ducts or lobules in the breast. They do not metastasize and spread within or beyond the breast or surrounding tissue. So whether one's cancer is non-invasive or invasive will determine what treatment your doctor will recommend and how well you respond to your treatment. In most cases, the first step in the plan of attack is for the patient with breast cancer to have surgery to remove the tumor. There are 2 main types of surgery, a lumpectomy and a mastectomy. A lumpectomy is a surgery where only the tumor and the surrounding tissues are removed. In a mastectomy, it is a surgery that removes the entire breast. Another approach which can occur before or after surgery is radiation. It is a treatment that uses high doses of radiation to kill the cancer cells and shrink the tumor. Even though radiation can be a useful approach and may work, there are still many risky side effects. Some side effects include irritation, fatigue, and can even damage healthy cells and tissues near the treatment area. Chemotherapy is another plan of attack that is commonly recommended. It is drug treatment to stop the growth of cancer cells. However, just like radiation, it does have some risky side effects, such as hair loss, fatigue, nausea, and changes in appetite. Cancerous cells can always grow and spread, but these 3 treatments discussed have worked for many other people, and if your doctor recommends, it is definitely worth a try. Many people think breast cancer only affects women because we only hear about women with breast cancer. However, what we don't realize is that men can develop breast cancer too. Men, like women, also have breast tissue, and their duct cells and lobules can undergo cancerous changes even though they are less developed than women. Among all breast cancer cases, around 1% are found in men. A late diagnosis is typically a big concern for men due to the lack of knowledge that men can get breast cancer too. As you can see, breast cancer can affect both men and women, and it's very tough to go through considering how extensive the treatments are. To gain further knowledge about what cancer is and what treatments are like, you can look further into the American Cancer Society. Breast cancer can potentially affect all of us, which is why I wanted to bring awareness to the topic and really grab your attention, for it is something of importance and it could save one's life. Thank you for listening.